Thank you to Ross and to the New Zealand Drug Foundation for inviting me here. I actually have to go back tomorrow, unfortunately, so I don't get to see very much of your lovely country, but I look forward to coming back and seeing a bit more at some time. I've been an academic conducting research. Oh, do we get slides, by the way? I do have slides. Yeah, okay. Okay. Oh, I do it. So I've been an academic for the past 25 years or so, conducting research on changing trends in drug and alcohol use, looking at the meanings and motivations for drug use, the pleasures and the problems, particularly interested in recreational drug use. And at the heart of a lot of my research has been users themselves, interviewing users, surveys, ethnographic observation research in pubs and clubs. But what I wanted to talk about today is what came out of that, which is setting up an NGO, a not-for-profit social enterprise, how I got involved with that, and the introduction of drug safety testing in the UK last summer, what I think the benefits of that are, and also the wider significance. And both what Catherine and Marianne said just now was very salient, I think, to some of the things I want to say, but particularly that this isn't the whole solution to the whole problem, but I think it can be part of the solution to part of the problem, as Marianne so elegantly put it. So, I'll say something about the UK context in terms of the drug market there, because it is quite different to Australia and New Zealand, and something about the policy, the political context. Then, not sure how much people know about this, so I'll briefly zoom through what drug safety testing is, when it emerged, what some of the benefits and the challenges are, and the key indicators, and then finally what I think is important about it. So first of all then, in relation to the situation in the UK, in relation to demand for drugs, I'll talk specifically about ecstasy at the moment, but this has wider relevance in relation to other party drugs, particularly cocaine and ketamine. So you can see in the UK we've got fairly high drug use. Have the highest levels of drug and alcohol use across Europe, but it's fairly stable. It hasn't really changed much over the last couple of decades in terms of adult ecstasy use. Around about 1 in 20 people have had ecstasy in the past year in the UK, so that's the sort of level that we're looking at. And I've been part of an academic debate in relation to the extent to which it's become normalised in the UK, particularly in drug and clubbing cultures. If you look at where people take ecstasy, it's predominantly in clubs and festivals, no surprise about that. That's what the Global Drug Surveys found. Although it does vary considerably between festivals and clubs, depending on the genre of music and the demographic that are going there. But in my research, I find roughly 1 in 3 people at an electronic dance event will be using illegal drugs at that event. And at the moment, what we're seeing, the pattern we see is alcohol use, particularly preloading if it's very expensive alcohol at an event. We're seeing ecstasy use and ketamine, and the combination of those is meaning that we're seeing a lot of nausea as well. So my charity is involved with some welfare work, and what a lot of our welfare work involves is chill out, is supporting people, but also dealing with the repercussions of those sorts of polydrug combinations. Unlike, I think, Australia and New Zealand, the sort of key difference, I think, is that drugs in the UK are very easily available, very cheap, and very high purity. And that has its own problems. In the UK, we're seeing a rapid increase in drug-related deaths. So just to give you an indicator of that, for the first statistic I've got there, is that in 2010, 8 people died in the UK from ecstasy-related deaths, and that went up to 2015 to 57, and that's the highest, second highest on record. And we're expecting, when the figures come out this month for the previous year, 2016, we expect it to be even higher. The interesting thing is that 5-, 6-, 7-fold increase in drug-related deaths mirrors a 5-fold increase in the MDMA content in pills. And we're also seeing an increase in festival deaths as well. So last year, 6 people died, drug-related deaths at festivals. All this is leading to great concerns in relation to the management and regulation, the policing of festivals and of events. In relation to the ecstasy market in particular, what we're seeing is more and more different pills, different shapes and sizes, great varieties in terms of the content as well as the appearance. And although most of these pills are medium or high strength, sometimes they are a great concern. So we had red Superman tablets that circulated in 2014-15, and they contained 175 milligrams of PMMA. And so potentially a couple of those could be lethal. So this high and variable strength illegal market is leading to repercussions in terms of fatalities. The wider context to this, though, to these increased drug-related deaths and increased festival-related deaths, is from 2010 we've had massive cuts to public sector, including policing. So we've got 20% less funding for police and 20% less police in operation, although that cut hasn't gone through to the army. We've actually got more soldiers but less police. We've also, as Catherine touched on as well, we've seen a shift from 2010 in terms of increasingly drug services are focused on abstinence-based recovery, alongside a significant slashing in the funds for harm reduction services, and the key performance indicators tend to be about how short the treatment episode is and getting people out of treatment. So the focus has gone from getting people into treatment in the UK to getting them out of treatment. Combined with all of this, interestingly, from 2010, we had the coalition government, which was Liberal and Conservative. And now the Conservative government, they push a policy, a localism and sort of sceptical of state centralisation, but a localist agenda, which has given more power in all sorts of ways to the regions, which is relevant in relation to drug policy in a way that I'll mention in a minute, but counterintuitively for a Conservative government. Along with that, we're seeing growing calls for drug policy reform. All of us have been involved with that around the world. But there's also been an interesting shift in the media, whereas it used to be that the assumption would be the media would be undoubtedly critical of drug policy reform agendas. We've definitely seen a shift. And one of the interesting elements of that has been the role of parents who are bereaved, whose children have died in relation to drugs. Is they've always been the go-to people in terms of some sort of rampant prohibitionist comment. But in the UK now, we've got an organisation, a charity called Anyone's Child, and the parents, they've all lost children themselves in relation to drugs, and they've become vocal advocates of drug policy reform, brilliantly informed on the statistics in relation to drug policy issues, as well as them pulling all the emotional strings. And they've been fantastic allies for us in terms of changing the media debate, because the sort of lazy journalism that we used to see doesn't hold true anymore. So because of all of these different and sometimes contradictory trends, what we've seen is at local level some interesting diversionary schemes. So diversion away from the criminal justice system and into drug treatment or into wider health interventions. And I've given some examples there, which I could speak for half an hour about each, but I won't. I'll just as a snapshot say Durham, where I'm at university, has got what's called Checkpoint, and it's currently a pilot project where when people are arrested, they randomly, and there's an ethical debate in relation to that, randomly they're assigned either to go through the normal criminal justice route or they have some sort of an appropriate intervention. And that could be in relation to if it was shop theft or domestic violence or drugs as well, that the idea is they would have an appropriate intervention rather than go through the criminal justice system. And that's being very well received, not least because of the fact that it's seen as saving money for the criminal justice system. And saving money for the criminal justice system is a significant drive in relation to progressive drug policies in the UK. We don't have the police to be policing drugs in the way they used to, so we have to be thinking about doing things differently. And that means that the police sometimes are at the cutting edge of these changes. So the Checkpoint scheme was devised and is being rolled out by the police. In Bristol, we've got the Drugs Education Project, and that was also devised and rolled out by the police. And what happens in Bristol is they've basically decriminalised personal possession of drugs. And it's really interesting because people in the UK don't even know about this, that if you're caught in possession of any drug in the UK, as long as you go on a drugs awareness course, so it's a bit like speeding awareness course, if you go along, you attend, you engage productively, you will have no further action and you'll have no criminal record. So we have de facto decriminalisation of personal possession of drugs in Bristol as a city in the UK. Again, it's a pilot project. Packaging something as pilot is good. You're more likely to get it through, I think. And the police packaged it as a pilot project. That's been going over a year now, saving lots of money for Bristol Police, and it looks like that's going to roll out. We've also got discussions of a drug consumption room in Glasgow, and then I'm going to talk about massed multi-agency safety testing, as we called it, and I see that as very much part of this this development of a regional rollout of a more progressive, alternative sort of drug policy initiative. So what we're seeing is the police are increasingly open-minded to evidence-based policing. What does the Home Office think about this? I describe it, or I would have until this week described it, as a sort of neutral, detached, observing from a distance sort of attitude, and some private disassociation. But it's worth saying that our Prime Minister, Theresa May, is personally opposed to any changes to drug policy. She's committed to prohibitionist agenda, and she personally disagrees with drug safety testing. And I know that because I've personally clashed with her on that her view is the reason that drugs are illegal is because they're dangerous, therefore we don't take them, and therefore we shouldn't do anything to make drugs safer to take. People should just not take them in the first place. By making drugs safer, we're removing the deterrent value of prohibition, which is obviously very good at protecting people, as we all know. So that's the way it goes. So in amongst all of that, I suppose having conducted research for 25 years on changing trends in drug use, writing policy recommendations that sometimes people read and had very little effect, there's a sense of professional frustration that we were shifting towards a recovery-based agenda and losing the few harm reduction services in the UK that had really been flagship harm reduction services in relation to dance drug scene and recreational drug use. So myself and a friend of mine who's a DJ and promoter, we decided to set up our own NGO. Not that we knew anything about it, but it was just we thought we had to do something, and there was a vacuum that we felt we needed to be stepping into. So we set up The Loop, which is a not-for-profit social enterprise. We've got over 250 volunteers now, and we do not describe ourselves as a peer-to-peer organisation. We describe ourselves as professionals. Interestingly, most of our volunteers are professionals who share our professional frustrations around the slashing of harm reduction services. So we have quite a lot of drugs workers who in their day job are increasingly focused on abstinence-based recovery, and they put out of that frustration they wanted to get involved with our harm reduction service at the weekends. We also have over 40 PhD chemists who help with the testing, so we've got a brilliant bunch of volunteers. We provide harm reduction and welfare services at a number of nightclubs, some of the biggest, most famous dance clubs in the UK, so the Warehouse Project in Manchester and Fabric in London, and also at about 10-12 festivals in the UK and across Europe. We do all the usual welfare stuff, so brews and blankets we call it, because in Britain in festival season the weather could be just as bad or probably a lot worse than your winter time. So actually we give out tea and blankets to people at summer festivals. Occasionally sun cream if the sun does come out, condoms, free water, that sort of thing. And also from 2013 we started conducting on-site testing, and this is really where my academic research fits in with this, because I've spent 25 years interviewing users, talking to them about their drug use, and then thinking, we don't necessarily know what the actual substances are. There's a disconnect there between what people think they've bought and what they've actually bought, and we need to match those two together. And the only way we can do that is to talk to individuals, engage with them, test the drugs that they have, and find out from them individually what they think they've bought. Because we can test all the drugs in the world, but if we don't know what they've actually bought, we can't make that connection individually. So that we got involved with testing. I shadowed the Home Office. Then Theresa May found out what I was doing and pulled the plug on that. So myself and my colleague put our own money into buying equipment, and I'm going to say knowledge is power. Actually, access to forensic testing equipment is power. That really made the difference for us. We could actually say, we've got equipment that the police can't afford to buy. We have police come and take photographs of our equipment, such as the sort of austerity measures in the UK. But what that meant was that we had an open door from the police because they wanted us to go on site and do the testing that they couldn't afford to do. So in 2016, we introduced drug safety testing into the UK. It's sometimes called drug checking, pill checking, all sorts of different terms. The main features of drug safety testing are that people will bring a substance, forensic testing by a service. They usually receive the results as part of some sort of a consultation or intervention. Usually no substances are returned for legal reasons, although occasionally peer-to-peer organisations will do that. And then there might be variations in terms of the types of analysis used, the test waiting times, the type of consultation, who might be delivering that, and then whether it's located within a drug service. For example, in the Netherlands, you'll drop off your sample and come back a few days later, and it will be sent to a lab. So that involves an element of pre-planning, or it might be at an event. And so we've been conducting testing at festivals, so directly at events. And then sometimes services vary in terms of whether they just give the results to the service user, or do they then also give the results to other agencies, either on site or in the local area. And then there's variations in terms of the degree of integration with other drug services and whether there are onward referrals to other drug services. And this is nothing new. It's been going back for 50 years or more, originally late 60s, early 1970s in San Francisco and other parts of the States and Canada and Germany, generally located in treatment centres. But then with the rave scene from the early 1990s, we started to see testing at rave events. And also the Netherlands, they have a system which was established in 1992, the Dutch Drug Information Monitoring System, which from the point of view of Europe is probably our best monitoring system. They've got records going back to 1992 of all the pills that are manufactured or circulated. But then we've really seen another wave of interest in drug safety testing just in the past few years. So yourselves in New Zealand, obviously in Canada, and for us in the UK. And I think there's been a couple of drivers of that. Firstly, new psychoactive substances. We have a situation where there are hundreds of possibilities for what a sample might be, as opposed to just 1, 2 or 3. But also the analytical capabilities. We now can test things with small suitcase-sized implements, and we've got one over there, if you haven't seen it, which is exactly the same as the equipment that we use, and literally, I can carry it across a field and plug it in. So and that's changing all the time, and it's getting better all the time as well, and getting more affordable. So that trade-off of speed, accuracy, portability in terms of testing on site is improving so much. We're able to do this testing on site now. So then the question becomes, why not do it? So why would we do it? We can identify missold drugs, contaminants, adulterants in circulation. We can also potentially identify variations in strength and purity. But also, as Marianne said, and Catherine highlighted as well, this is an opportunity to engage people who might not be in touch with drug services, with a drugs worker, with a brief intervention, and possibly onward referral to services. So harm reduction can be capturing people earlier on in their drug-taking career, and potentially before they might consider drugs to have emerged. We've also got intelligence then that we can spread to other on-site services, so that can help in terms of incidents and emergencies on-site, as well as off-site to wider stakeholders, police, public health and so on. We can monitor the drug markets as well, and as I said before, uniquely we can make this connection between what people thought they bought and what they'd actually bought, which wouldn't otherwise be possible. So last summer we introduced what we called multi-agency safety testing. The reason we called it that was calling it something like drug checking was politically unacceptable. The idea that we were checking was, it implied that we would be condoning drug use. So we had to come up with a term which was bland and vague and not contentious. So we came up with math, and an acronym helps as well. So we've got, ours is a free service. It's totally anonymous, non-judgmental. The way it works is that people put 1 dose of a substance into a little clear baggie and they put it into an amnesty bin, get a unique ID number. I've talked to people over the past couple of days about how much you put in a bag, and obviously in the UK, because drugs are relatively cheap and easily available, that's not such an issue. But I am aware that in Australia and New Zealand, that is much more of an issue, how much you put in the bag. We ask for one dose, so 1 pill or 1 scoop of powder. The reason we want 1 pill is one of the things we do is estimate the strength of that pill, so we need a whole pill to be able to do that. We then got 4 different types of analytical techniques. I won't say too much about that, but we're improving all the time. We've got 4 different types. Infrared, ultraviolet spectroscopy. We also do use reagent testing, which is really good for highly potent substances like LSD or 2CB. And we've also got a wet extraction method of chemistry to identify the MDMA content in pills. People come back about half an hour later to get the results. to get the results, they have to sit down and have a 15-minute brief intervention with the drugs worker. And that was really important for us in terms of getting our foot in the door to be able to deliver this service, that we weren't just going to be willy-nilly giving out results. And it was also really important that we said these were trained drugs workers. They have at least 2 years clinical experience, because when people come in and get the results, we ask them what's their drug history, what's their experience, what are their previous problems with various drugs. We talk to them about medications, their alcohol consumption, and then we give them the results of that particular test. And then we give them the harm reduction advice in relation to that particular test. And then the final thing that we ask them to do is do they want us to dispose of any other substances in their possession? Most of the drugs are destroyed in the testing process, I should say, so nothing's given back to them, but there is this optional disposal service. So we collect the drugs off them if they've got any other substances of concern, and then they're passed on to the police to be destroyed. And we also have, we've asked some people if they'd be willing to give us their email addresses, and about 2/3 have, surprisingly, separated from the service. We asked them to put their email address, drop it into a bucket, and the idea is that we're now going to be doing follow-up online surveys afterwards with people. In terms of the legality of it, after we conducted these 2 masked pilots last year at 2 festivals in the UK, after we finished the second of those 2, the Home Office sent an email to the police and asked them, is it legal? The irony of that is extraordinary. This is the Home Office asking the police, is it legal? I say yes, it is. I say yes very enthusiastically, but it is a legal grey area, there's no doubt about that. The important thing is we're there with the full support of the police. We're not going to get arrested by the police because they want us there. As far as they see it, is because we are testing the drugs on their way to be disposed of by the police, we're not really necessarily in possession because they're a part of that process. So the testing is secondary, if you want to see it like that, to the police seizure, and I would just hope that the judge would see it like that if I had to say that in court. So we don't give anything back to people, as I said, the services, because that will be supply. But one of the things which is legally tricky for us is, and I've heard this is similar in New Zealand, is by giving people harm reduction advice, you could be considered to be facilitating drug use or inciting people to commit the crime of taking drugs. And therefore, we have to flag up, we bookend at the beginning end of the intervention, no drugs are safe, all drugs are potentially problematic, there are always risks involved, nothing's totally harmless, we're not encouraging or condoning drug use. So we have to say that at the beginning and end of the intervention, and that's to protect our volunteers from being potentially at risk of being arrested for inciting somebody to commit a crime. So that's very important. They almost read out a script in relation to that for their own sake. But there's also a concern that the police have and the events have, which is, what if somebody gets our results, they take the drug, and then they die? And this links back to what Marion said. These are people who've already bought the drug, they're already planning to take the drug, they've already smuggled the drug into the festival, they're already intending to take it, and therefore the only thing that we could do is, by our intervention, is influence them not to take the drug in that trajectory. So therefore, from the point of view of liability, it would be very difficult to prove that, because what you'd have to prove is that that person had no intention of taking the substance until we gave them the information. We think, why would they use a testing service if they had no intention of taking it? However, it's still something that we have to be mindful of and flag up. What we do say to people with the test is, this is the test for this particular substance. There might be variations within that batch, there might be variations at the festival, there might be variations in terms of every other pink pill in existence, that we're just telling you what is in that substance that you submitted for testing. So we have to flag up all these caveats around it. The other thing that we have to flag up, though, is that whatever we say is in the pill might be 120 milligrams of MDMA, an average dose for a large man. We don't know then how many they're going to take. So that one pill by itself might not contain any contaminants. It might not be particularly high dose. If they're going to then go out and take another 5 along with ketamine and cocaine and a lot of alcohol and dance for 15 hours, yes, then there might be increased health risks. So there's also the issue, as Catherine said, about drug set and setting, and we have to be mindful of flagging up the wider issues, the wider context in relation to their drug use. And the festivals, particularly in the UK, there's a lot of binging going on. There's a lot of polydrug use. People start their day with lager for breakfast, and then it goes on from there. And so that is a particular concern, a particular vulnerability. Hence, we had 6 people die in the UK last year, all of which were polydrug deaths. They weren't related to contaminants. They were just related to people going on a vast 4-day bender. So the issue then in relation to possession, as I said, is potentially staff or customers could be arrested for possession of drugs. We have drugs in our possession, but what the police do, because they want us to be there, we're there at their invitation, is we have a tolerance zone, a non-enforcement zone. And there is a precedent for this, a legal precedent. We've had a lot of legal opinions about this. I spent a lot of time with barristers over the past couple of years checking all of this out. And the way that the lever we had for this was in Leeds, there's a prostitution tolerance zone. So the police agree not to arrest people in relation to soliciting for prostitution in this small area of central Leeds. So there's a precedent that the police can have a non-enforcement zone. So basically what we're saying is our tent is a non-enforcement zone in relation to possession of drugs. The police are happy to go along with that because they want us to be there. Interestingly, though, we also had the conundrum of festival drug policy. And in the UK until last year, all festivals had a zero tolerance of drugs policy. It was a piece of paper. It meant nothing in practice. Nevertheless, it existed. And when we went to quite a lot of festivals to discuss this, they said, great idea, but we can't possibly do it because we have a zero tolerance of drugs policy. And we'd say, OK, but leaving the policy aside, what do you think about this as a practical harm reduction approach? Great, but we've got zero tolerance. So we had this, and interestingly, the biggest kickback for us was from public health. It was public health that clung on to this. So one of the festivals we were at last year, they devised a new policy, which they called the 3 Ps, and this was prevent, pursue and protect. Prevent drugs getting onto the site, so they did absolutely everything possible to stop drugs getting on site, sniffer dogs, searches, everything. On site, they would focus on pursuing dealers, but they would also focus on protecting the general public. And the idea of that was that harm reduction then could fit within the protect aspect of it. And once they had a policy that they could fit it into, that was then okay, and we were able to go on site and to do this. And this policy now has been adopted by Festival Republic, and Festival Republic are the biggest festival brand in the UK. They run all the big festivals, Leeds, Reading, V North, V South, Latitude, Download. More than 500,000 people go to their festivals per year. So the fact that we've managed to work out a way to move on from zero tolerance has been really productive and important for us. In relation to possession, though, in the Misuse of Drugs Act, Section 544, if you're interested, is that people are allowed to destroy drugs themselves. So if you're a teacher in a school and the pupils had drugs, you could take the drugs off them and flush them down the toilet. You would not be in possession of the drugs because you are planning to destroy them. So this is sort of the thing that we argued. And it was accepted last year, and it was accepted up to this week. And I'll say a bit more about that in a minute. So what were the what happened in relation to our two festivals? We conducted 3 or 4 days of testing at each festival, Secret Garden Party and Kendal Calling. We tested 249 samples at Secret Garden Party and 50 at Kendal Calling. Oh, I talked too much. It was a social event. People came in groups of 4 to get their test results. It wasn't an individual undercover operation at all. What we found was that if 249 samples were submitted at Secret Garden Party, 1,000 people on average came. The festival had 25,000 people. That meant 1 in 25 people at that festival directly came and engaged with harm reduction services. They tended to come in the afternoon when they were more sober and straight, which we were very pleased about. But also some people came on a Sunday, and we hadn't expected that. They came on a Sunday to find out what the problems were with the substances they took on Saturday night. So there was an element of post-consumption education that was going on. We also we identified contaminants and adulterants on site of concern. So we found boric acid was being missold as cocaine, malaria tablets, chloroquine, had been ground up and missold as cocaine. We found concrete had been made into ecstasy tablets, 100% concrete. But we also found a massive variation in pills themselves. So pills varied from 20 to over 250 milligrams of MDMA. and that's on one day and one festival. So you can see that even if people want to be moderate, sensible consumers of these substances, it's an illegal market and they don't know what's in them. We shared this intelligence with people right across the services, and that was also, the results were also submitted on social media, and I'll have more of the details in an article that's coming out later this year. How do we measure success? Disposals, as I said, we had an option for people to dispose of their drugs at the service. 18% of people who used our service then went on to give us more drugs that they said they didn't want to take, and we destroyed. So we took nearly a fifth of the extra drugs out of circulation. The users were pleased with that, the police were pleased with that, and the paramedics were pleased with that. Another way to measure success is in terms of planned discarding. So they don't necessarily give over the drugs, actually physically, but they say they're planning not to take them. And so in your own New Zealand work last year, 52% said they had no intention of taking the substance when it wasn't what they expected. An interesting thing also is people say they're going to go back to their dealer and get a refund from the dealer. Some research in Portugal, 43% said they would change their dealer. We also found that when we said to people, what are you going to do? They said, we're going back to the dealer for a refund. So we've got a really interesting feedback loop that we wouldn't have expected previously with dealers. Also, people say they're going to take less, they're going to warn their friends, they're going to look up more on the internet in future. So there's various other ways that we can measure behaviour. Probably another sort of hard statistic, which we have very little data for, but which I'm interested in, is does this reduce medical incidents on site? Does it reduce hospitalisations? Could we hope that it could reduce drug-related deaths, which obviously would be a key goal for us? So at Secret Garden Party, when we were there was 1 hospitalisation. The previous year there'd been 19. We don't know how much our testing played in that reduction of hospitalisations. We can only hope that it played a part, and it will only be a small part, but there was a general move at the festival that they wanted to have less hospitalisations and they wanted to treat people on site more. And what the medics said to us was that our testing helped them have more confidence to do that, to not send people to hospital. Also, there's a potential in terms of early warning systems. As I said, one of the reasons for doing this is that you can help inform the wider market about drug-related trends. And I'll give an example of that, the red Superman tablets that I mentioned. In the Netherlands, where they did the testing, they sent out a red alert and nobody died. In the UK, we didn't have the testing, we didn't send out a red alert, and 4 people died in the UK before we had the news go through about what was in the substance. So it can have a really valuable role, not just on site, but in terms of the wider community. And the last thing that I'll end with, because I think I don't want to run over time, is to say, and this also relates to what Marion said, is what about the absence of negatives? One of the criticisms of drug safety testing is it could increase initiation and it could increase prevalence. And generally the research has found it's either stable, i.e. it doesn't increase prevalence, or actually the opposite. And there's a study of 3 European cities that was conducted, and they found that initiation actually reduced, because when you send out the information about some of the horrible things circulating on site, which for us was boric acid, cocaine and concrete, so boric acid, malaria tablets and concrete, is that actually this deters people from even trying drugs in the first place when they realise just what horrible things are circulating on site. So from my research, what I'm trying to be doing is to gather some of this evidence in relation to indicators of success. This summer we're hoping to be at 8 festivals, but I'll just end with a little postscript, which is that I've been conducting the back-of-house testing for 4 years, and the Home Office has said for 4 years that we don't need this particular licence. And then here, while I was here this week, we've just had a message that the Home Office now says that we do need this particular licence, and they've said this 10 days before our first festival, and we don't have time to get that particular licence. So they've thrown a spanner in the works, so we're still battling with bureaucracy in relation to this, but we will be at some festivals, that's for sure. Okay, thank you.